Welcome to Module 2, where we'll dive into MAPP 2.0, the structured process that guides many health departments through effective CHA and CHIP efforts. MAPP stands for Mobilizing for Action Through Planning and Partnerships. It was developed by NACCHO to help communities identify strategic priorities and act collaboratively. MAPP 2.0 is an updated, more accessible version of the original model. It's built around equity, flexible timelines, and real-world adaptation, features that were shaped by feedback from the field. In this module, you'll explore the core phases of MAPP 2.0, understand how they align with FAB accreditation, and review tips for implementing the process at your local health department, even with limited staff or funding. Let's get started with an overview of MAPP 2.0 and how it evolved. MAPP 2.0, developed by NACCHO and released in 2023, is more than just a planning tool. It's a way to bring people together around a shared vision for health improvement. It walks you through a cycle of organizing, assessing, planning, acting, and improving. Where some frameworks focus only on the technical side, data, indicators, strategies, MAPP 2.0 integrates the human side too, which is collaboration, communication, and capacity building. It's especially helpful in aligning diverse partners, from public health to healthcare to community-based organizations, and creating a transparent, phased approach that works even if your resources are stretched thin. Throughout this module, we'll unpack each phase so you can see how the process can guide your CHA-CHIP efforts in a strategic and inclusive way. So what's new in MAPP 2.0 compared to the original version? MAPP 1.0 laid the groundwork, providing structure to public health planning, but MAPP 2.0 refines and modernizes that foundation. It simplifies the number of phases, integrates quality improvement and equity more explicitly, and offers more practical tools for local adaptation. One key improvement is the clearer focus on implementation. MAPP 2.0 isn't just about assessment. It helps you move from identifying needs to taking action, and it supports that action with theory of change methods and continuous improvement principles. It's also more flexible. Whether you're a rural department with a small staff or an urban department with multiple partners, you can scale the approach to fit your reality. MAPP 2.0 has 3 core phases, each of which builds on the last. Phase 1 is all about laying the foundation, building your team, creating shared ownership, and setting a vision. This is where collaboration starts and where leadership buy-in really matters. Phase 2 is where the assessment happens. You'll tell the community story through data and engagement. This includes both numbers like mortality rates and access to care statistics, and stories like lived experience and community concerns. Phase 3 is focused on action. It's where you move into the CHIP, applying what you've learned to prioritize and implement strategies. MAPP 2.0 emphasizes continuous improvement. So even after you act, you monitor, reflect, and adjust. This structure helps your health department stay aligned, responsive, and accountable over time. Phase 1 is where you build the foundation for your community health improvement work. Think of this phase as setting the table, gathering the right people, establishing trust, and defining the process together. It begins with forming a core team. This should include staff from your health department, but also community partners, leaders from hospitals, schools, social services, and ideally, representatives from the populations you most want to serve. Next, you'll clarify roles and expectations. Who's leading the process? How are decisions made? What's the timeline? Establishing this early builds credibility and prevents confusion down the road. This phase also includes developing a shared vision, a compelling, community-informed statement of what a healthy future looks like. When done well, this vision becomes the compass for the rest of your planning. MAPP 2.0 encourages co-ownership of this vision, which strengthens commitment from partners. You'll also start to think about evaluation early on. How will you know if your CHA and CHIP process is working? What feedback loops will you build in? Setting up evaluation from the start ensures accountability, and helps you track progress over time. So, and as you can see on this slide, we have a stakeholder and power analysis, CHI leadership structures, engaging and oriented steering committee, and an administrative structure, a starting point assessment, visioning, and then CHI infrastructure priorities and work groups, and a work plan and budget. There's a lot of detail on here, so you can get really complex, but you can also keep it really simple. So whatever works best for you and your team. Phase 2 is telling the community story. This is where the real discovery begins. In this phase, you'll collect and interpret data to understand the community's health needs, strengths, challenges, and opportunities. The goal is to tell a full and honest story, one that includes both hard numbers and human experiences. This starts with assembling your data team, your assessment design team, along with your data sources. Those might include quantitative data such as vital statistics, hospital admissions, behavioral risk factors, and environmental indicators. But MAPP 2.0 also encourages strong qualitative data like surveys, interviews, focus groups to capture perspectives you can't see in charts alone. Importantly, the story isn't just written by public health professionals. MAPP 2.0 emphasizes working with community members to interpret the data together. This starts in step 1, where you form an assessment design team of partners in the community, and it goes all the way through step 6, where you share those findings. So this phase really provides an opportunity to lift up health equity by disaggregating data, for example, by race, ethnicity, income, age, geography, zip code. You can surface disparities that might otherwise remain hidden. Ultimately, this phase results in a shared understanding of where your community is today and where the greatest opportunities for improvement lie. This sets the stage for prioritization and action. So there's 4 primary MAPP 2.0 assessments that I'm going to highlight and I think are particularly important. The first one is the starting point assessment. This helps your team take stock of where you are, your capacity, your partnerships, and your current understanding of community needs. It helps you design an assessment process and design team that's grounded in reality and aligned with your resources. The second one is the community status assessment. This includes quantitative data, health outcomes, disease rates, social determinants of health, and so much more. It answers the question, what's happening in our community, using traditional quantitative data. Third is the community partners assessment. This looks at the organizations, institutions, and people working on health. What assets do they bring, and how can you engage them effectively? And fourth is the community voice assessment, or context assessment. This is often the most powerful. You look at what's contributing to health in the community. It oftentimes is qualitative, including interviews, focus groups, and storytelling to understand residents' perspectives and experiences, what they've seen, what they felt, and what they prioritize. The status and context assessment have a lot of overlap. Each of these assessments adds a different dimension to the story, and when you bring them all together, you get a rich, well-rounded picture of your community's health landscape. And that's where they talk about triangulating the health issues from the partner status and context assessment. So once you've told the community story, you've got your team all together, you told the community story, well, now what? Now you get to work. Phase 3 is where your chip comes to life. You've assessed your community's needs, gathered all these voices and data. Now it's time to prioritize and do something about it. This phase is built on the principle of continuous improvement. That means you're not just creating a plan and walking away. You're building a system of action, evaluation, and refinement that evolves over time. Start by identifying priority areas. Use the data and engagement insights from phase 2 to focus on the most pressing, feasible, and equity-aligned issues. MAPP 2.0 encourages the use of a tiered prioritization process to help guide these decisions, categorizing issues into primary, secondary, and tertiary levels based on urgency, resources, and readiness. Then you can develop your approach based on theory of change, for example. This means mapping out the outcomes you want to see and working backward to define the activities that will get you there. Root cause analysis, logic models, and other tools can help here. After planning, move into implementation. Assign roles, set timelines, identify metrics, and build in evaluation from the beginning. And don't forget to communicate back to your community. Closing the feedback loop builds trust and encourages continued engagement. MAPP 2.0 reminds us that community improvement is a cycle, not a checkbox. This phase helps ensure that your health department and its partners are in it for the long haul. At this point, you might be wondering, how does everything we've discussed about MAPP 2.0 really connect back to day-to-day public health practice? The CHOT process is more than a requirement. It's a strategic tool that supports nearly every function of your local health department. It guides how you prioritize funding, design programs, build partnerships, and evaluate your impact. MAPP 2.0 strengthens this by giving you a roadmap. It helps you go beyond surface level data and dig into root causes. It helps you work collaboratively instead of in silos. And it helps you connect the dots from community voice to strategic action. Whether you're applying for grants, reporting to your Board of Health, or engaging with the public, CHIP gives you evidence-based justification for what you're doing and why. When the process is aligned with MAPP 2.0, and you're not just checking off steps, you're building a public health practice that's data-informed, community-centered, and ready to grow. So implementing MAPP 2.0 doesn't have to be overwhelming, even though it very much feels like that at times. Whether you're just getting started or revisiting your process, there are some practical tips that can make a difference. First, don't skip the visions and the values. That's where community buy-in begins. Secondly, customize that assessment sequence to fit your resources. Third, use rapid engagement tools when needed. You might do something like short-term improvement. You might do something like a quick Zoom call to get everybody re-engaged. But just do what you got to keep people connected. And document everything. This supports replication and accreditation. And then finally, factor in equity and sustainability throughout the process. It's so critical to make sure that you're looking at where differences exist so that you can use your resources most efficiently. That's going to contribute to your sustainability by both identifying these really important needs, things that we as a community know we need to work on, but doing so in efficient ways so people can trust that the resources are being applied in a responsible manner. Every community is different, and adapting MAPP 2.0 to fit your local context is essential. This slide outlines some common barriers and strategies to overcome them. So first, scale your approach to your resources. We have a lot of limitations in resources, and in public health, currently that's becoming more of a problem. If your department is small, start with a narrower focus or pilot the process in one part of your jurisdiction. Don't let perfection be the enemy of progress. Second, use the tiered tools strategy. Good, better, best. Maybe you can't run full focus groups, but you can do key informant interviews. Maybe you don't have time for a full community dashboard, but you can create summary reports with local maps and charts. Third, anticipate common barriers. Time constraints, leadership turnover, limited buy-in. These aren't unusual at all. Build flexibility into your timeline and revisit your engagement strategies if momentum dips. Fourth, embed flexibility into the design. Phased implementation can help departments that need to balance other demands. You can always revisit and deepen assessments or strategies later. And finally, build cross-sector support. Many of your partners, schools, hospitals, nonprofits, are working on the same issues. Share the load. Use partnerships to fill resource gaps and gain broader ownership. Just like in Module 1, we're returning to a key idea. CHA and CHIP are central to FAB accreditation, as is MAPP. What MAPP 2.0 does is give you a clear way to meet those standards with confidence. Domain 1 focuses on assessment. Through MAPP 2.0's assessments, community voice, community status, and community context, you're collecting and analyzing the data required to meet those measures. Domain 5 focuses on planning. When you move into phase 3 of MAPP and develop your chip, you're fulfilling FAB's expectations for collaborative, evidence-based, actionable planning. It doesn't stop there. Domains 4, 7, and 9 are also touched through strong engagement, cross-sector collaboration, and continuous improvement. When you align your MAPP process with FAB requirements, you're not just improving community health, you're strengthening your department's systems and its ability to demonstrate accountability and impact. This alignment also makes reaccreditation smoother. Your child chip becomes living documentation that provides your department is learning, adapting, and improving over time. So let's go a step deeper and look specifically at how MAPP 2.0 aligns with FAB accreditation standards. Each phase of MAPP 2.0 maps clearly to key domains in the FAB framework. Phase 1, building the Community Health Improvement Foundation, supports domains 4 and 10 by strengthening partnerships and infrastructure, documenting how you build your CHA team, how roles are defined, and how decisions are made, all aligned with these standards. Phase 2, telling the community story, connects directly to domain 1. You're collecting, analyzing, and sharing data on population health. If you include disaggregated data and ensure broad community participation, you're also addressing equity-related measures and communication standards from domains 3 and 7. And phase 3, continuously improve the community, supports domain 5 by demonstrating how your chip was developed collaboratively and is being actively implemented. If you use quality improvement tools and monitor your chip's progress, you're also aligning with domain 9, which focuses on continuous quality improvement. This kind of alignment isn't just helpful for meeting accreditation, it makes your entire process stronger, more coordinated, and easier to communicate to funders, partners, and your community. FabMap 2.0 aren't two separate checklists, they're complementary. Integrating them means your CHA chip process becomes a living example of your department's capacity, accountability, and impact. Let's say your team is conducting the community voice assessment or community context assessment. If you intentionally disaggregate responses and prioritize underserved populations, you're addressing both equity and the engagement standards required by FAB. Or during phase 3, if you create a theory of change or a logic model, and you use it, or a logic model using the theory of change, or incorporating concepts from the theory of change, you're showing alignment with domains 5 planning standards and domain 9's focus on evaluation and improvement. Integrating these frameworks doesn't require duplicating work. It's about using one to reinforce the other, and it simplifies documentation. When you use the MAPP process intentionally, you're building much of the content you'll need to meet FAB requirements naturally as part of your workflow. That's the benefit of alignment. It builds internal consistency, clarity for your team, and a stronger case for your department's leadership in community health improvement. So let's ground this in a real-world example, which I was going to put a recording in here, and that's an improvement that will come to this presentation in the future. But for now, let me just talk through this. Let's imagine a Nebraska Health Department using MAPP 2.0 to revamp its community health improvement efforts. After organizing a broad-based steering committee, they used all 4 assessments, starting point assessment with that group, community context, community status, and community partner assessment, did a clear and well-rounded picture of their community. What they discovered through engagement with residents and disaggregated data was that access to behavioral health and transportation were major concerns, especially in rural areas and among seniors. They prioritized these issues using a tiered framework and developed a chip grounded in equity, guided by the theories of change, and co-owned by community partners. Not only did this health department meet FAB standards across domains 1, 4, and 5, they also secured additional funding through collaborative grant applications and built stronger community partnerships with their healthcare providers. This kind of story shows how MAPP 2.0 can drive both process and outcome improvements, and why it's such a valuable tool for Nebraska local health departments. So equity is at the core of MAPP 2.0. It's not just a value, it's embedded in the tools and the process design. There's a primer called the Power Primer and the Starting Point Assessment. For example, asking you to examine power dynamics or systems of influence, partner representation, and structural barriers from the beginning. It prompts you to ask, who's not at the table, and why. In Nebraska, we've seen innovative examples of LHDs putting this into practice. At Lincoln Lancaster County's Health Department, staff used spatial sequential sampling to ensure that every census tract was represented in their survey. This approach helped them capture data from communities that are often underrepresented in health assessments. Meanwhile, Panhandle Public Health District focused on equity in action. Their CHIP prioritized access to behavioral health and childcare, issues identified directly by residents in underserved areas. They aligned their strategies with what communities said they needed, not just what the data alone suggested. These examples remind us that equity isn't an extra step, it's how we ensure our child CHIP work is inclusive, impactful, and responsive to those who need it the most. By embedding equity into each phase of MAPP 2.0, you strengthen your public health practice, and you build trust and legitimacy in your community. So let's wrap up everything we've covered in Module 2. We've introduced the MAPP 2.0 framework, a structured, inclusive, equity-driven process for conducting child CHIP. You learned about the 3 core phases: building the foundation, telling the community story, and continuously improving through action. We compared MAPP 2.0 to the original model, explored how it aligns with FAB accreditation standards, and saw how it can be tailored to fit your local health department's capacity. We also highlighted how equity can be embedded in each step and showed examples from Nebraska local health departments already doing this work. Whether you're new to MAPP or looking to refine your approach, this framework can support deeper engagement, clearer planning, and better alignment with accreditation and community needs. So here's some key takeaways. MAPP 2.0 is a phased, equity-centered framework for child CHIP. The 3 phases of building the foundation, telling the community story, and improving the community's health help guide your work from planning to implementation. Each phase aligns with FAB accreditation standards and supports documentation across the board. Nebraska local health departments have adapted MAPP to their local needs and advance equity in real ways. Keep these principles in mind as you move into the next module focused on FAB accreditation and documentation strategies. So now that we've pretty much completed this module, here's a few steps you can take. Review your current child CHIP approach and see how MAPP 2.0 phases apply. Identify which assessments you've done and which you still need to explore. Start drafting a shared vision statement if you're in phase 1. Talk with partners about the process and how to build buy-in. Coming up in Module 3, we'll focus on FAB accreditation in more depth, including documentation, strategies, real examples, and how to align your child CHIP work with accreditation requirements. So again, next we'll dive into Module 3, where we'll take a closer look at FAB accreditation. You'll learn how to document your child CHIP work to meet specific FAB standards, explore real-world examples from accredited health departments, and walk away with practical tools to strengthen your documentation readiness. So whether your department's preparing for reaccreditation or just starting its journey, this module will help you align your child CHIP work with those expectations. And lastly, here's a slide with an overview of the type of things we'll be able to share. If you're accessing this via LearnWorlds, they're included in this course. Otherwise, please reach out to me and I'll see if I can get you those.